vision in only one eye can happen for many different reasons. Some are completely harmless and easy to fix, while others could threaten your eyesight if ignored. So before you panic, or worse, before you ignore it, watch this video until the end, because one simple symptom could reveal more about your eye health than you ever imagined. Let's find out why only your left eye becomes blurry. Welcome back to Eye Health and Vision Science, the channel where we simplify eye care using real science and practical advice. If you care about protecting your eyesight, make sure to subscribe and turn on notifications so you never miss our latest eye health tips. Now, let's begin. The first thing you need to understand is that each eye works independently. Even though your brain combines images from both eyes into one clear picture, each eye has its own cornea, lens, retina, optic nerve, muscles, and blood supply. That means a problem affecting only one eye can make that eye blurry while the other eye stays perfectly clear. The real question is, which part of your left eye is causing the blur? Cause number one, you simply need a different prescription. Believe it or not, this is the most common reason. Many people assume both eyes always have the same vision, but that's not true. Your left eye may naturally have a different prescription than your right eye. Maybe your right eye is close to perfect, but your left eye has become slightly nearsighted, farsighted, or has developed astigmatism over time. Since your brain relies heavily on the stronger eye, you may not notice the weaker one until you cover your good eye. That's why thousands of people discover blurry vision in one eye completely by accident. An eye examination can quickly determine if your prescription has changed. But here's the important part. If your blurry vision appeared suddenly, especially within hours or days, it is probably not just a glasses problem, and that's where things become more serious. Now let's talk about one of the most overlooked reasons for blurry vision in only one eye: dry eye disease. Most people think dry eyes always affect both eyes equally, but that's not always true. It's actually very common for one eye to produce fewer tears, or for tears to evaporate faster than the other eye. When the tear film becomes unstable, light can no longer focus properly on the surface of the eye, making your vision appear blurry. Here's an easy way to recognize it. Does your vision become clearer after you blink a few times? If the answer is yes, dry eyes could be the reason. You may also notice burning, itching, redness, a gritty feeling like there's sand in your eye, or excessive watering. Surprisingly, watery eyes can actually be a sign of dry eyes because your eye is trying to compensate for the lack of healthy tears. Several everyday habits can make dry eyes worse: spending hours on a computer or smartphone, sitting in an air-conditioned room all day, wearing contact lenses for long periods, aging, especially after the age of 40, certain medications, including some allergy medicines. The good news, dry eyes are usually treatable. Artificial tears, taking regular screen breaks, staying hydrated, and improving your blinking habits often make a significant difference. But remember, if lubricating eye drops don't improve your blurry vision, it's time to look deeper, because another common problem may be developing inside the eye itself. Many people think cataracts only affect elderly adults. That's actually a myth. Although cataracts become more common with age, they can develop earlier due to diabetes, eye injuries, smoking, long-term steroid use, or even prolonged exposure to ultraviolet sunlight. A cataract occurs when the eye's natural lens slowly becomes cloudy. Instead of allowing light to pass through clearly, the cloudy lens scatters light, making everything look blurred or hazy. If the cataract starts in only one eye, that eye may become blurry while the other remains perfectly clear. Besides blurry vision, you might notice increased glare from headlights at night, difficulty driving after sunset, colors appearing faded or yellowish, frequent changes in your glasses prescription, double vision in one eye. Unlike dry eyes, blinking won't make cataract-related blur disappear. The cloudiness stays there because the problem is inside the lens, not on the surface of the eye. If your eye doctor confirms a cataract, don't panic. In the early stages, stronger glasses and brighter lighting may help. But as the cataract progresses and begins interfering with daily life, cataract surgery is one of the safest and most successful procedures performed worldwide. However, not every case of blurry vision is caused by dry eyes or cataracts. Sometimes the real problem is happening in the retina, the delicate layer at the back of the eye responsible for sending visual information to your brain. And when the retina is affected, blurry vision could become a true medical emergency. Now let's talk about the causes that should never be ignored. Your retina is a thin, light-sensitive layer located at the back of your eye. Think of it as the camera sensor of your vision. It captures light and sends signals to your brain through the optic nerve. If the retina becomes damaged, your vision can suddenly become blurry, and in some cases, permanent vision loss can occur if treatment is delayed. One of the most serious conditions is a retinal detachment. This happens when the retina begins to pull away from the back of the eye, cutting off its normal blood supply. Without immediate treatment, the affected part of the retina can stop functioning. Warning signs include a sudden increase in floaters, bright flashes of light, especially in the side of your vision, a dark shadow or curtain moving across your vision, sudden blurry vision in one eye. If you notice any of these symptoms, don't wait until tomorrow. Seek emergency eye care as soon as possible. Early treatment can often save your vision. Another possible reason is damage or inflammation of the optic nerve, the structure that carries visual information from your eye to your brain. A condition called optic neuritis can cause blurry vision in just one eye. Many people describe it as looking through fog or a dirty window. Unlike dry eyes or a cataract, optic neuritis often comes with pain when moving the eye. Colors may also appear faded, especially the color red. Because the optic nerve is part of the nervous system, these symptoms require prompt medical evaluation. Yes, an eye can have a stroke. Although it's less common than a brain stroke, an eye stroke happens when blood flow to the retina is suddenly blocked. This usually causes sudden, painless vision loss or severe blurring in one eye. People with diabetes, high blood pressure, high cholesterol, smoking history, or heart disease are at greater risk. This is a true medical emergency. The sooner treatment begins, the better the chances of preserving vision. When should you see an eye doctor immediately? So how do you know whether your blurry vision is something minor or something serious? Seek immediate medical care if your blurry vision is sudden and severe, accompanied by flashes of light or many new floaters, associated with a dark curtain or shadow over your vision, combined with eye pain or severe redness, accompanied by weakness, difficulty speaking, numbness, or facial drooping, which could indicate a brain stroke. Remember, your eyes are closely connected to your brain and nervous system. Sometimes blurry vision is more than just an eye problem. It can be the first warning sign of a serious medical condition. Can you test it at home? By now, you're probably wondering, is there a simple way to check whether my blurry vision is serious before I visit an eye doctor? While no home test can replace a professional eye examination, there are a few simple checks that can give you useful information. First, cover your right eye and look at a distant object, like a clock or a street sign. Then switch and cover your left eye. Ask yourself, is the blur only in one eye? Does blinking make it temporarily clearer? Is the blur only at a distance or also when reading? Has it appeared suddenly or has it been getting worse over weeks or months? If blinking improves your vision, dry eyes may be the cause. If the blur stays the same no matter how much you blink, the problem could be inside the eye, such as the lens, retina, or optic nerve. But remember, these checks are only for awareness. They cannot diagnose the exact cause. When you visit an eye clinic, your eye doctor doesn't just check whether you need glasses. Instead, they'll perform several tests to identify exactly where the problem is. First, you'll read letters on an eye chart to measure your visual acuity. Next, your doctor will determine whether a new glasses prescription improves your vision. Then comes a slit lamp examination, where a special microscope is used to examine the front of your eye, including the cornea, tear film, lens, and iris. Your eye pressure may also be measured to screen for glaucoma. Finally, your pupils may be dilated with special eye drops. This allows the doctor to carefully examine the retina, optic nerve, and blood vessels at the back of the eye. In some cases, advanced imaging tests such as OCT, optical coherence tomography, or retinal photography may be recommended. These scans provide incredibly detailed images of the retina and can detect problems long before they become visible during a routine examination. One of the biggest mistakes people make is trying to treat blurry vision without knowing what's causing it. Remember, blurry vision is a symptom, not a disease. If dry eyes are responsible, lubricating eye drops, regular blinking, and reducing screen time may solve the problem. If your prescription has changed, a new pair of glasses or contact lenses may restore clear vision almost instantly. If a cataract is the cause, cataract surgery may be recommended when it begins interfering with your daily activities. For retinal diseases, optic nerve disorders, infections, or eye injuries, treatment may involve prescription medications, laser procedures, injections, or surgery. These conditions require professional medical care and should never be treated with home remedies alone. The good news is that many causes of blurry vision can either be prevented or detected early with a few healthy habits. Start by giving your eyes regular breaks from digital screens. If you spend hours on a computer, follow the 20-20-20 rule. Every 20 minutes, look at something about 20 feet away for at least 20 seconds. This simple habit reduces eye strain and encourages normal blinking. Next, stay hydrated. Your eyes depend on a healthy tear film to keep vision clear. Drinking enough water and using artificial tears, if recommended by your eye doctor, can help prevent dry eye symptoms. Protect your eyes from harmful UV rays by wearing sunglasses that block 100% of UVA and UVB radiation whenever you're outdoors. Long-term sun exposure can increase the risk of cataracts and other eye diseases. If you have diabetes, high blood pressure, or high cholesterol, keeping these conditions under control is one of the best ways to protect your eyesight. These diseases can silently damage the tiny blood vessels inside the retina long before you notice any changes in vision. And finally, don't skip routine eye exams. Many serious eye diseases develop without pain or obvious symptoms in their early stages. Let's clear up a few common myths. Myth number 1, if only one eye is blurry, it's probably nothing serious. Fact, not always. While it may simply be a prescription change or dry eye, sudden blurry vision in one eye can also signal a retinal detachment, optic nerve problem, or even an eye stroke. Myth number 2. If the blurry vision goes away after resting, I don't need an eye exam. Fact, temporary improvement doesn't always mean the problem is gone. Some eye conditions come and go in the early stages before becoming more serious. Myth number 3. Eye drops can fix every type of blurry vision. Fact, artificial tears only help if dry eyes are the cause. They won't treat cataracts, retinal diseases, glaucoma, or optic nerve disorders. So why is only your left eye blurry? The answer depends on the underlying cause. It could be something as simple as needing a new glasses prescription or treating dry eyes, but it could also be a warning sign of a cataract, retinal disease, optic nerve damage, or another serious condition that requires immediate medical attention. The most important thing to remember is this: if blurry vision appears suddenly, becomes worse, or is accompanied by flashes of light, floaters, eye pain, or a dark curtain across your vision, don't ignore it. Seek emergency eye care immediately. Your eyesight is too valuable to risk. Outro and call to action. If you found this video helpful, give it a thumbs up and share it with someone who cares about protecting their vision. Subscribe to Eye Health and Vision Science for evidence-based eye care tips, vision science, and the latest information to help keep your eyes healthy for years to come. And now we'd love to hear from you. Have you ever experienced blurry vision in just one eye? What was the cause and how was it treated? Share your experience in the comments below. It could help someone else. Thanks for watching, stay informed, protect your eyes, and we'll see you in the next video.